Welcome, welcome. This is Dr. Bartolomescu, the Medical Futurist, and I'm so glad to meet you again after this long summer break. We are about to launch the newest season here at the Medical Futurist. I know we've done this 100 times, but I hope that everything is all right, that you can see me and hear me well. Please let me know in the chat as soon as possible. So now I know that we can jump right into the topics we have planned for you today. So what you can expect from us, from me, on this channel in the new season? Well, plenty of things. First of all, we spent the summer analyzing the future of hospitals, the hospitals from the future, and we published a comprehensive guide about all these. And this is the topic for today's live Q&A session. For those joining me from the Eventbrite website or from our YouTube channel, welcome, welcome. Thank you. Andrea Kontz, our editor-in-chief, is also here in the chat. And if there are any articles, analysis we can share with you, she will include the link in the chat. In the meantime, please let me know from where you are joining me. I would love to see, what kind of parts of the big globe we are covering here. So today's topic is the future of hospitals. But from the new season at the Medical Futurist, you can expect many more things to come. Just a glimpse into a few things, besides all the topics we will cover, from how to work with artificial intelligence to other exciting things. We will cover how to live with a wireless blood glucose sensor. And you cannot imagine how much I've been struggling with this thing here, because in my country, the application doesn't work. So I have to hack my way into wireless blood glucose monitoring. You will see a review about a device called BioBeat, with which I could measure my blood pressure for 24 hours. It was quite the experience. Among others, you will see for the first time on this channel a gastric sensor. Now, let me show you on the inside. Yes, it's a sensor that will go on my stomach and it will analyze my digestion. It's quite an exciting thing to do. I've never tested anything like this before, but now I will. So many exciting things to come, many incredible topics to be covered on the Medical Futurist. For those who don't know me or the channel, we at the Medical Futurist, we try to provide the context around technologies in digital health, in artificial intelligence. We try to help individual patients and medical professionals, investors, developers, policymakers, people from business, people from medicine or healthcare, to better understand how these advanced technologies can contribute to care, to the practice of medicine, to the health and disease management of patients. For this, we publish a lot of content, free articles on medicalfuturist.com, free analysis daily on our social media channels on Instagram, YouTube, Twitter, Facebook, and LinkedIn. TikTok soon, I know. We publish ebooks and videos and live Q&As and all these with your help, as many of you support us on this channel. Many of you support us on patreon.com, and many others support us by buying the ebooks that we provide. We can keep on providing free content on a range of channels that I just described. So guys, welcome from Budapest, welcome from Pakistan, from Sri Lanka, from the US. It's good to see you people being here. You've sent me quite a lot of questions before the Q&A event started, so I will go through them. But the point of the live Q&A is to be able to ask live questions, and I will do my absolute best to answer them. Why am I doing this? Because I have medical background. I did my PhD in clinical genomics. But when I finished that, more than a decade ago, I switched to futuristic studies. So since then, I've been working as a professional futurist. I'm a researcher. And my job, 8 or 12 hours a day, is to analyze all these trends, to try to forecast the near future, and then hopefully to be useful for the whole medical healthcare community while preparing for whatever is coming next. Hi from Brazil, hi from Canada. It has been quite a long summer. I hope all of you had a good summer. I didn't that much. I had hepatitis A from a restaurant in Budapest. I will describe my journey. The reason why is that digital health technologies helped me keep myself sane during this roller coaster, hell of a ride in the last 3 months. So I will publish the first video about that. This is the video that will be the premiere of our new season tomorrow, how digital health devices help me recover from a serious infection. Hello from Argentina. It's good to see some names that sound familiar to me. You have taken part in previous Q&A lives. So I saw that there were a few questions even before the Q&A started. Good thing to do, submit them as soon as possible. Ariel Mola, as usual, I don't give career advice. That's not the kind of live Q&A we have here for. There was a question from Andral. What is the most essential technology in 2023? And there was a second question. What can we not live without in terms of new technology in hospitals? Well, I think I understand what the question implies, but of course the real answer is that CT scans, if you look at intervention cardiology, we cannot live without CT scans, but I understand what your question implied. And if I have to think through a range of new advanced technologies, then I would say that any sensor, any platform, any device that allow remote care in any forms would be essential in the near future. Gio, what's new about free healthcare? I don't know what free healthcare you are referring to. Please clarify. Hi from Athens, Greece too. So there is a question, quite a long one here, about the future of hospitals, because that's our exciting topic for today. Let me share that with you here. So will we need huge space and layouts in future hospital design? With reference to digital healthcare, which departments are likely to disappear or shrink in future hospitals? Very good question, very good question actually. I think the physical buildings will exist even 20 years from now, but their role will be different from what they have in hospitals today. Hospitals will mainly be used to rejuvenate ourselves or to use huge radiology machines we cannot bring home, and other treatments and procedures medical professionals are in a better position to perform if they are at the same place instead of patients being at their homes. I see really specifically designed spaces for remote care, for conducting remote care from inside the hospital. This has been quite the trend during the pandemic, that many physicians worldwide realized that when they tried to talk with patients remotely through a smartphone or a tablet's video, they needed a special space, a space designed for this purpose, with the normal lights and normal video camera setting and a spacious room without anyone else in the same room. So we will have specific design for conducting remote care in those hospitals. I think for emergency care and interventional specialties, the hospital have a firm future. For many other specialties, patients will become the point of care. This is the end story of the digital health paradigm shift. And in that sense, hospitals will have a smaller role in treating those patients. And I think that's the point when I want to show you what we have been working on throughout the whole summer. Here it is. No, you can't see that yet. You will see it just in a second. Here it is. No? Here it is. So, a guide to the future of hospitals from the future. It's on LeanPub as usual, and it's a long guide where we try to cover some important topics. First of all, the concept of the point of care. Then we describe elements of hospital design through case studies and real-life practical examples. Then, obviously, some technological trends that will heavily impact hospitals' future, including 5G to wearable health sensors to even virtual reality, 3D printing, or portable diagnostic devices. We describe the role of nurses and physicians in those new hospitals from the future, the impact technology giants can have in designing hospitals today. By these giants, I mean Amazon, Microsoft, Apple, Google, and so on. We talk about cybersecurity and privacy, because it's impossible to avoid these topics when talking about the future of hospitals. And in short, we describe at the end what a hospital from the future will look like. And you can also go to medicalfuturist.com right now, and you will find our summary about this ebook. We summarize this in 5 points what kind of major findings we made or discoveries we made while working on the ebook. And you can find this free article on medicalfuturist.com right now. And again, if you want to buy it, you can buy it on leanpub.com. There is a 60-day money-back guarantee, as for every single ebook we have ever published. So please check it out. Until then, let me keep on going with the questions. All right, next one is from Lina Chu. Let me share a question with you. Will digital health and AI technology take away healthcare jobs as the trend has started? How will AI or the digital health era provide job opportunities for seasoned healthcare professionals? That's a very smart question to ask. Thank you for asking that, Lina Chu. I think that digital health and AI will lead to a paradigm shift in the way healthcare is delivered. Patients will be the newest members of their medical team. They will sit at the same table where only physicians had been sitting for thousands of years. And then automation will become the second newest member of that medical team. I think that will lead, automation in general will lead to losing a few jobs. The reason why is that if a job contains repetitive and or database components, not only I think that those jobs could be replaced, but I think they should be replaced, because repetitive and database tasks don't require human expertise and vision and knowledge and intuition and creativity. Just to give you a real life example, I do think that the vast majority of radiology images will be processed, analyzed by artificial intelligence. In some places, it has been the case already. When there is a very special, very complicated case, then those will be flagged by the AI for human radiologists to check them out. But even with that, it's the fourth level of automation, by the way. Even with that, a radiologist should only look at like 5 images a day, not 40. And if your radiology image is number 37 in the line, you would not be happy about that. But if they only have to check out 5, that sounds like a reasonable thing to do. And as AI progresses forward, and it will progress forward, I think radiologists will eventually stop looking at radiology images, but every radiology algorithm and AI-based medical technology will have to be developed by radiologists. So in that sense, the rule I always tell people after my keynotes will still be in line, namely that AI will not replace medical professionals, but those medical professionals that use AI will replace those that do not. And hospital design will have to reflect this extensive use of AI in the near future. All right, Diego Pereira, what do you think about the metaverse and hospitals? There is any new application? It's a very smart question to ask, because the metaverse is just the new big thing. Well, even though it doesn't exist yet. But virtual reality has been tested in clinical trials, in evidence-based studies, and it has been shown that VR can be used to reduce pain for patients staying at the hospital for treating phobias and PTSD, among others. VR has a place in healthcare. The concept of the metaverse is different, though. It would imply that every participant in the healthcare ecosystem, from individual patients to medical professionals, could join the virtual reality on the same platform, at the same virtual location. And by doing that, they would be in a better position to share data, to discuss issues, than they would be if they were meeting in person. As a VR user myself, I can't imagine that happening in the next 5 to 10 years. VR gears are so expensive that it simply won't become accessible by then. I think even just making a physician talk with a patient through a video chat on a smartphone or a tablet is technologically complicated enough now that to make them switch to a virtual reality platform, which is much harder to be used, I can't imagine that happening in the near future, being widely accessible. I tried to, I know it's a silly example, but I tried to play the new Half-Life game, Alyx, on my VR set, Oculus Quest 2, it took me half a day to try to connect my gear to my Steam account to be able to play the game. Half a day. And all my geekiness was used in that process. We can't expect patients and physicians to go through the same technological hell. Wow, Jorge Cardona has a very exciting question. Thank you for asking that. Let me share that with you here. How do you how you can invoke intuition or creativity when the real data, first or second source data and sensors are available more easily every second? Okay, I think I get the question. Even though, so patients used to have the same data they can access now through wearables 10 years ago, but they didn't have the interface to access those data. The reason why it's different now is that they can have the interfaces, they can obtain as much data as they want, but the reason why intuition and creativity won't be pushed out of the doctor-patient relationship, of the jobs of medical professionals, is that just by analyzing all my data, I cannot solve my medical issues. Even by reaching out to an automation-based system to analyze all my data I obtained about myself, it doesn't mean that your health issues will be solved. Simply because medicine or practicing medicine is not a linear process. That you give me all your data, I analyze it in the same way, and then I give you the final solution. Unfortunately, that's not how it works. It would be great if it worked like that, like in transportation or other industries, but it's not the case. So the way a patient comes in to meet a physician, the way the patient starts to describe their symptoms, the way patients with different conditions can describe the same symptom, and patients with the same condition can describe absolutely different symptoms and experiences, all these things indicate that we will very much need the intuition and creativity of physicians, maybe even more than today, when 60% of their time must be spent on doing administration. When AI-based technologies can replace those repetitive database tasks, what's left would be empathy, creativity, intuition, human knowledge, human experience, basically human skills, which are very hard to be replaced by automation. And Lara, what a great question to ask. What will be the role of the nurse? We have a whole section dedicated to that in the new ebook, and I want to share an article with you which we published not so long ago about 8 digital health technologies transforming the future of nurses. And let me give you a real-life example about what would happen to nurses. And for this, yes, I want to show you something in a second. I want to share a video with you because that will give you a perfect picture about what we can expect from the nursing profession here. So here is quite a famous video about a robot taking a blood sample, not this one, this is a real person, but here there's a robot using ultrasound imaging, and it can take a blood sample of a patient. It never has a bad day, it doesn't make mistakes. I like that example very much because it just presents an advanced, exciting technology. Can you imagine yourself sitting on a chair and a robot coming to you to take your blood sample? You would be terrified. I would be terrified, and I'm a geek by heart. I love technologies. But I think even though I would be very much open to a robot taking my blood sample, because I would understand the importance of automation to be used in the process, I would need someone to soothe my nerves, like a nurse full of empathy, being around me, making sure that everything is working in the way it is supposed to be working. So I think the role of nurses will be more human connected, more emotional, more cultural than technological. But still, there are many technologies, digital health technologies, that nurses should know about, and we share these in this article, which I just shared with you in the chat as well. So thank you for the question, Anna. Hello from Mongolia, hello from Hungary, hello from France. It's so good to see you again after this long summer break. We will have plenty of live Q&As in the near future with exciting topics to cover. Love the human connection. Thank you, Anne. yes, it's going to be the profession, the nursing profession will have to get transformed because of these new technologies. Jamie Hannah Shackleton has a question about decentralized collectives. Let me share the question with you. Hopefully you can see it now. Oh, I love the expression decentralized autonomous organization. I have never come across that, so I have no opinion on that, but thank you for pointing that out. I will dive into this topic. Like 2 years ago, someone asked me about NFTs and I had no idea. Now we've published many analysis about how NFTs could help patients make money by allowing other companies to sell their precious data to third parties. So thank you for the idea here. We will look into DAOs. Mihir Dantala, is the provider industry ready to cater to new skill requirements such as hospital technologists? Yeah, it's a great question to ask. I don't think so. I even think that not even the medical schools are ready to help future physicians acquire the required new skills. Not even hospital managers know enough about the importance of the digital health paradigm shift to be able to help their medical professionals in postgraduate education to acquire the relevant skills. So for now, medical professionals are on their own about how ready they want to get for working with empowered patients, for working with digital health technologies, for analyzing data coming from sensors. But I get what you imply with the question is that some new jobs or roles will arise out of the use of these technologies. And that's why we published this article. I'm just sharing you with the chat, and I also want to show it to you here. 7 futuristic professions in healthcare you can still prepare for. I think there was data analyst. Yes, there is a health data analyst profession I highlighted here. So it's a very timely question that you ask because it makes sense to have such data analyst working in hospitals. Oh, thank you, Anne, for the feedback. I'm very glad that you can share it with your students. Hopefully, if they are nursing students, hopefully they get a vision about what kind of a future profession they can work towards from now on. Jorge Cardona, from this point of view, live by numbers is only a utopia, and the doctors could continue their exercise supported only in the so subjective clinical perceptions. I'm not sure if I understand the question, Jorge. Can you please clarify a little bit? And of course, I'm happy to talk more about the role of the patient or consumer of healthcare. Well, I think that the role of patients used to be a passive stakeholder role, waiting for a symptom to appear and only after that ask for medical help. I think that role of the patient is transforming into an empowered patient role where they very much want to get engaged with their health and disease management. And if you think we at the Medical Futurist Institute have never published anything about that, then of course you will be wrong. And that's why I'm sharing an open access paper with you we published by interviewing the world's most forward-looking patients. As for the role of healthcare professionals, I think it used to be a role of key holder to the ivory tower of medicine. And now it's transforming into a role of sort of a guide for their patients in the jungle of digital and health information. And of course, we at the Medical Futurist Institute have a study about that too, and it's called Digitally Engaged Physicians it was published in PLOS ONE. I'm just sharing the link in the chat with you now. Frederick Abramson, thank you for the question. How can we shift from helping people to die healthy to giving them paths to living well? It's a very hard question to ask. I guess healthcare government should be able to answer that, but they don't. They haven't yet. Well, I think we should, by we I mean people working for healthcare, we should stop trying to be the parents of patients. And instead, we should just be there to facilitate patients' transition to a more empowered, engaged, proactive role. because many patients are inspired and motivated by themselves to be empowered. They don't need our permission, and we don't have to push them towards the empowerment. They will do it by themselves, and the only thing we should do is just to facilitate that transition. This way, we would finally help them obtain the data, the insights, the knowledge, the information to have a chance for a longer and healthier life. I think that's what we should do here. Kamal Bhartia, what a nice point to make. Why is no one talking about the physician experience? Everyone is focused on the patient experience. I'm telling you why. The reason why is that for 2000 years, everything in healthcare and medicine has been circling around medical professionals. Only medical professionals could access data, studies, knowledge, evidence, and technologies. Only medical professionals could discuss these issues. Only they had the answers to the questions. Patients, who are the most important elements of healthcare, have been just a neglected stakeholder, which is nonsense. And that we had to arrive to 2010, 2012, when the digital health revolution started, to finally find out, or maybe realize, that it should be about patients, and everything else in healthcare, including physical buildings, hospitals, a point of care, medical professionals, should be circled around what patients need. And that's why now there is a big transition in discussions, and we all focus on the patient experience, because nobody has done that for 2000 years. And we have only been doing that with physicians. That's why. It's very important. I understand what you imply with the question. It's very important to focus on improving the jobs of medical professionals. And that's going to happen because patients become empowered. That's why we have to focus on the paradigm shift we call digital health, which is mainly about welcoming patients and as the newest members of their medical team. Francine Lemire, it's all of the questions you mentioned are very good questions. Following on your comments, given the dynamic environment we are in, how do we begin to prepare frontline healthcare providers for this? What is core to curriculum at this time? I'm so glad that you asked the question this way, because I can share the thing I'm the most proud of working at the Medical Futurist, the digital health course. This is the reason why I'm showing you this course, is because, well, basically I answer your question. In that course, we describe everything a medical professional could know about digital health, the major digital health trends, the paradigm shift, the difference between health IT and digital health, technological trends, how to forecast trends yourself, the business side of digital health, the foresight, the patient empowerment, the timeline of digital health, everything that can be known about digital health in general. I've been teaching medical students for more than 10 years about these, and I added all the skills, the approaches, the knowledge I've been transmitting to medical students into that online course that anyone, not just medical professionals, are welcome to take. And in that sense, if I had to summarize the major skills, I would say literacy, I would say the ability to work with empowered patients, I would say a sort of technological literacy, very similar to digital literacy. Digital literacy is more about online websites and using smartphone apps. Technological literacy is more about obtaining data from health sensors, portable diagnostic devices, understanding the role of automation in all that. So I think these skills would be crucial in that sense. Tobias Kirstein, welcome to the chat here. Hi from Germany. How do you think the digitalization of administrative workflow will look like in hospitals? For example, organization of patient flows, particularly in context of new technology. Very good question to ask. I think we have to arrive to paperless hospitals. Only a few hospitals have managed to do that, such as the one that the Cleveland Clinic launched in Abu Dhabi. We must go paperless. It leads to fewer errors. It leads to fewer administration, at least on paper. Plus, it's simply not efficient. And I think patient workflows and patient flows in general the way they come into the hospital and how they are being orientated, like from a blood test to an X-ray, all these will have to be automated. Otherwise, we have no chance of making this happen through the healthcare the doctor shortages that we have worldwide. So if we could assign a person knowledgeable in that hospital to every single patient to help them orientate in the hospital, that would be amazing, right? The experience would significantly change for patients, but we don't have that many healthcare professionals. That's why we have to automate it. As an added bonus, it would also mean that we could decarbonize patient pathways through this. Just imagine that if ride-sharing applications like Circulation or Uber Health could help bring patients to their appointments, so they would not miss those appointments, leading to hundreds of millions of dollars in losses every year just in the US healthcare system. We could not just decarbonize the patient pathway, but we could also make the whole system more efficient. We actually published an article about that, 5 methods of decarbonizing patient pathways, and one of our newest videos in the new season in about 2 weeks will be about that topic too. Someone named School asked this question: how do you think the medicine on Mars will differ from those on Earth? Is there any sense to think about it now? I don't think that medications or medicine in general would be very different. I have a keynote narrative in which I describe scenario where an astronaut stranded on Mars would receive medical care from afar. And through that example, I describe why it's so similar to what a patient goes through in a hospital back on Earth today. So I think if we can solve healthcare's major problems today here back on Earth by just making remote care the new norm, it would be essentially the same as treating someone on Mars. Maybe with a bit of message delay, because it takes your message 20 minutes to come from Mars to Earth and vice versa. Otherwise, I think every technology used in the process would be the same. Kamal Bhartia, it's a good point. I'm not sure how relevant it is to the future of hospitals, but let's discuss it. What about physicians turning into patients due to burnout? They face barriers while accessing healthcare, like lack of time, confidentiality. It impacts patient safety, operational efficiency, absolutely. And mostly it has happened. It was a case before the pandemic began, but in many countries worldwide, it has become an even more severe case due to the pandemic's impact on physician burnout. Again, maybe remote care could aid that a little bit, because it would just ease the burden on the shoulders, on the pressure on the shoulders of physicians, but it requires a generational change on the level of society, which we might not have yet. All right, keep the questions coming. I hope we are doing fine here. We have 27 minutes left. Ray Dugom asked the question: will blockchain be part of future hospitals? I hope so. This technology should be part of hospitals today, because simply health IT security is not strong enough. I'm sure you've seen the reports I have seen about all those healthcare data breaches globally, and even patients died. There was a German story where a patient died during such a healthcare data breach malware attack. But in many cases, these attacks can take place because either the hospital has not spent enough money on healthcare IT security, or through social hacking. Those working at the hospital in the management not knowing enough about how they can be vulnerable to social hacking. So yes, it's a very important topic, and that's why we dedicated a whole, I think, chapter to this in our new ebook. Here it is: Factoring in Cybersecurity and Privacy. So yeah, thank you for asking that question. All right, Paul Hackett has this question. Let me share it with you. Where are you seeing clear signs of a greater understanding of the role and importance of human-centric design when it comes to designing and improving patient experience? It's such a fantastic question to be asked, because this is at least one of my major topics, patient design itself, which means, and let me share a real life example with you from a study, from a paper I just published like 3 weeks ago with a patient scholar, e-patient Dave de Bronkart. I'm sharing the open access paper with you in the chat. And now I share the paper here. So in that open access paper, we describe the importance of patient design. And in that, we use real life examples here, such as the ones where in the Netherlands, in Nijmegen, there was a hospital, and the hospital wanted to open a new facility for their patients. But they invited their chronic patients to have their voices heard. And thus, patients could ask for specific things, part of design, a round table instead of a work desk, or designated space in the same room being a clinic where a physician can examine a patient. Really simple stuff, very cheap things that made sure that patient satisfaction skyrocketed, that made sure that physicians loved working in that space, and even hospital managers preferred those rooms to the others because everyone loved to work in those. So answering your question, I think patient design is crucial in those places where any kind of product is being developed primarily for patients. If it's a research project, a clinical trial, a technological product, a sensor, a healthcare app, a medication, a product, a treatment, a guideline, in all these cases, patient design should be in place. And for those who don't know what patient design means, it means that patients are involved on the highest level of decision making in an organization. On the CEO level of a company, on the health minister level of healthcare governments, on the leader level of healthcare organizations. Anna E. Schmaus Klughammer, or should we try to convince the administration and IT from hospitals? If it's a, oh, you had a first question, sorry. Whom do you think we have to convince about digital health, patients or doctors? I don't think we have to convince anyone. I think that this paradigm shift is being directed or controlled by patients. They are the first ones, the most motivated stakeholders to make it happen. I think we have a role in facilitating their process of empowerment. So maybe what we have to do now is twofold. Once we have to help medical professionals understand their new role in this new status quo by discussing it with them. And the second is maybe helping them acquire some new skills. And the second one is pressurizing policymakers to become knowledgeable enough so then they could regulate these technologies. Because if they don't, patients will find a way. And that's not a safe and efficient method that we should see in action, like the "we are not waiting" movement. Patients with diabetes hacking their wireless blood glucose monitors, not because they don't want to buy good ones, but because there are many that they cannot use in their own countries, but they still have a disease while a technological issue existing for their conditions. Of course, they reach out to these technologies. Guy Pereira had this question: what will be the role of mixed reality in the education of healthcare students and the training of healthcare professionals? Who will win this market from a content perspective? Mixed reality, the only example I know about is coming from Microsoft HoloLens. Mixed reality has been shown to be useful in medical education, that's true. But the devices are so expensive that to imagine the use of mixed reality gears widely in medical education is just a bit too science fiction at the moment. But mixed reality could be used for two purposes with evidence in the background. One is allowing medical students to have to go through the patient experience from the patient's perspective, this way building empathy for them. And the second is for preoperative planning, allowing surgeons to better prepare for certain kinds of operations. I think from the content perspective, third-party companies could win this market by either making mixed reality gears cheap enough to be widely accessible, or content on devices that these hospitals already own, so they will be in a better position to upload new content. Jessiane Viana, I hope I pronounce your name more or less the right way. What technologies and services are a must when building a new hospital, and what trends to look out for when building one? Well, that's why we published that ebook to discuss all these trends, to describe why patient design is crucial. So I think it's not technologies that matter in designing new hospitals, but concepts, patient design. The fact that digital health technologies make healthcare globalized. The fact that these technologies make healthcare, make patients the point of care. These are the concepts that should direct how a new hospital is being redesigned rather than which technology to focus on. 5G is amazing because it allows a greater connectivity remotely, but what if hospital designs everything based on 5G and we have 6G in 5 years? What if a hospital wants to put all the potential wearable devices around patients when maybe a tiny microchip as a skin patch will come out next year? You can't put a whole hospital design strategy on a few technologies. That never works. You have to put those strategies on firm concepts that will be the same even 15 years from now. Patients becoming the point of care, healthcare becoming globalized, the point of care shifting from physical buildings to wherever patients are. All these things matter, and these things will be important in why designing a new hospital. Paul Hackett, of course, it's my pleasure to share the human-centered design paper. Actually, if you want to dive more into the topic, then my co-author, e-patient Dave DeBronkart, writes heavily on the subject, so you might want to check out epatientdave.com as well for his articles. Kwame Amofa, thank you for this question about digital twins. What will be the role of digital twins in healthcare? How will the blockchain and smart contracts change or affect telemedicine and precision medicine? We talked about blockchain before, about how blockchain could help make healthcare data and IT security more secure, how NFTs could allow, for example, patients to financially benefit from companies or hospitals selling their data. But about digital twins, it's quite an exciting topic I'd like to talk about. One reason is why that we published an article about digital twins on medicalfuturist.com. Yes, here it is. I'm sharing the link in the chat video. In that article, we describe that digital twins can be used for many purposes in drug design, in testing treatment protocols, treatments, medications on patient models in silico clinical trials. Also, it could be used to test new drugs on patient-specific organs, like the patient has a heart disease. Digital twin can be made based on all the data and radiology images measured, obtained about his or her heart, and then new treatments, maybe precision state-of-the-art treatments, could be tested on the digital twin heart model to find out which one would work in action. I think that's the role of digital twins. It doesn't really have anything to do with hospital design. Digital twins could be part of everyday healthcare even today through AI-based services and technologies. But we are still in the very early years of this technology. And while the technology sounds very exciting, I haven't seen enough evidence-based studies to see a wide adoption of digital twins worldwide. Kamal Bhartia, what's your take on data ownership in the future? Will patients be able to own the data and sell the data to researchers or startups? Well, that's exactly what non-fungible tokens, NFTs, have the ability to do. There's even a company in the US, a genomic service startup, that helps patients get their genome sequenced and then would allow them to sell parts of the genomic data that would be precious to pharma and biotech companies for a small price. This way, even though their data would be sold later on to several third parties, they would always get a fraction of that financial benefit. Evelyn Silvasi, greetings from Hungary. Do you know a research group here in Hungary that is worth joining with a law degree if somebody want to help build digital healthcare? It's a good question. I guess where lawyers would be very much needed in the digital health paradigm shift would be groups of bioethicists. there are not many in this country, so if I were you, I would do a search for what bioethicists work on at University of Debrecen and Semmelweis Medical School in Budapest, and I would reach out to them because they usually need legal advice as they cover many things that are related to that. Mackenzie has a question. Future Mackenzie. I'm wondering if that's really your first name. What qualities will the physician leader of the future need to have? What a beautiful question to ask. I think the physician leader of the future, even today, should have very high levels of digital literacy, should be very knowledgeable about digital health, about automation, should have very smooth skills about discussing emotional, cultural issues with their patients and medical professionals, should be very good at doing business because healthcare will be a business even more than it is today. And maybe they should have a skill of forecasting, being able to predict the near-term future of technological trends or healthcare in general or medicine. And I hope you know that this is something I think I always tell you about, that you can just go to the Good Judgment project. Let me share the link with you. This is my favorite community site in the world. The Good Judgment project can be found at gjopen.com. I've been a member of this for like 6 or 7 years. It's for free for everyone. And what you can do is that you can see these quite complicated questions. And your job is to forecast the answer to these questions. Like here is one of my recently favorite ones. When will the WHO announce the end of the public health emergency of international concern related to COVID-19? And there are 4 brackets here. These are my estimations, by the way. You have 100% to divide among these answers. And then, of course, everybody else is doing the same. And later we have a crowd forecast. And when it becomes the case, when the WHO announces this, we will decide the winners. And we will learn a lot about your prediction scores, my prediction scores, and we can, what we do in the meantime is that we gradually become better at forecasting trends. So I think these will be the key skills for physician leaders in the near future. M. Abdelatif, welcome to the chat. Thank you for the question. Do you think insurances will pay for medical and lab test and consultation process via AI and digital health in the near future? I understand the question. I just don't think that is how it's going to work out. Insurance companies will keep on paying for remote care consultations or lab tests if those are evidence-based components of a physician caring for a patient. If it's just so for the sole purpose of this being processed via AI is not enough for healthcare and health insurance companies to adopt that technology. But if it's evidence-based and it works in action based on clinical trials and real-life data, then they would have to adopt it. And you see there's a big difference between whether they have to adopt and whether they would be open to adopt and whether they have to adopt it. So the latter only works through evidence-based clinical trials. Yesh Dahia, found your channel 8 days ago. Loved your content, brother. Thank you so much, brother. I'm very happy to hear that. New videos are coming out in the coming days. For example, tomorrow the season premiere comes out, so feel free to check it out. Eleanor Zioni had a question about the future of hospitals. What is going to be the essential element in a future hospital? Well, if I had to name a few, I would say rooms designed specifically for remote care consultations. I would say 5G connectivity, allowing patients to keep on using the health sensors in the hospital that they used at home. I would say artificial narrow intelligence, analyzing the processes, the patient pathways, the workflows, billing, medical records, administration would be essential. I think voice-to-text applications would be essential that could write down what the physician and patient discuss and the physician would only have to check at the end in the medical records whether the right things were written down. I guess big radiology machines will exist in these physical buildings, but papers will not. Maybe that's how I would summarize the essential elements of future hospitals. Haley McLaughlin has a very interesting question. What have been some of the key learnings from hospital designs that have gone wrong? It's interesting that you are asking that. I just gave a keynote 2 days ago to a pharma company, and they wanted me to, 3 times they told me to feature an example where patient design was used, but the end product was a failure. And I couldn't find any. I have 1 million followers. I asked my community about such examples, but nobody knew of any. And then I concluded that if finally patient design is used in action, it means it will lead to success. The same way I would answer your question in a way that I think I've only seen, while we did research for this ebook, I've only seen a few examples where things went bad, such as when a US company, I don't want to say their name, wanted to design the most futuristic, utopistic facility in the world, and they put all the technologies you can imagine, did smart mirrors, portable diagnostic devices, smart scales, everything, even things patients can use at home and own at home already. And it was so technological that it took away the real component of the digital health paradigm shift. The fact that we could finally allow patients and physicians to focus on each other while they are just being surrounded by advanced, seamless, and invisible technologies. I would say that would be, so putting all the technologies into one space would be a key bad example I've seen a few times, but just a few times. Because whenever hospitals started focusing on the importance of design, normally they made good decisions and it led to success. What is that? Yesh Dahia had a question. What is the technology you are 100% sure that will be available in the future, and while listening sounds impossible? I don't get the second part of the question, but about the first part, well, artificial narrow intelligence. I know I came up with the beast in the room, the most advanced technology, but I have 0% doubt that whether AI would have a place in the future of hospitals. I think it will be impossible simply to organize healthcare without artificial intelligence. Karan Singh Raj Purohit, thank you for a very thoughtful question. I today gone through your post on Africa. I had a social media analysis about news on Africa and the technologies they use there. So how can these dense populations and doctor ratio can be addressed with modern technology? I don't think that can be the case. I don't think that we need, in those regions with low resources, we need to put more technologies. I don't think that's the case. I think those regions should take a leap into digital health, like how Rwanda in Central Africa did that. Instead of building a healthcare system they didn't have the financials for, they took a leap into digital health and they started focusing on technologies not even the most developed nations have as a part of their healthcare system. Rwanda didn't choose it out of, being cool, a cool country or cool policymakers, but out of necessity, still it worked in action. Umit Kupali, it's a question not really related to the future of hospitals, just a bit because I mentioned that before that VR therapy is being used in hospitals today. It's not a matter of opinion whether VR therapy works or not. It's a matter of evidence, and there is a growing evidence in the medical literature that virtual reality can be used in treating phobias and PTSD. And I want to share an article with you that we did not so long ago about 5 ways VR is changing healthcare. Here is the article in the chat. Yeah, a few more questions going and only a few minutes left, so I try to catch up. Gunda Srinivas asked a question, how easy it would be to set up such future hospitals? Can there be an out-of-hospital ecosystem very different from the current models of healthcare? Well, Gunda, I don't think that these hospitals, that the future of hospitals will have to be built from scratch. I think the physical buildings we have today will have to be transformed into those futuristic buildings, because it's not the building that matters, it's the concepts, patient design, rooms designed for remote care. Those concepts are the ones that matter. And one more here. Karan Singh. How do we address the emergency situation by short waiting time and diagnosis of early stage emergency in populated remote places using technology and to get support and timely solutions to save human life? What a long question to ask. Well, for example, medical drones used in Rwanda by the company called Zipline would be an example for that there are bad road conditions. Sometimes the ambulances cannot even get to the location of an accident in time, but medical drones can do that. So in the case of emergency services, I think advanced technologies would have a role, even in developed nations, where the data could arrive at the hospital before the patient does, should be the main concept that emergency services follow while designing their services and workflows. School has one more question, and then I think we have to stop because we run out of time. How medical specialties can take into account the emotions, worries, and feelings of patients when treating them? What are the chances that psychosomatics could be applied in traditional medicine? Two things here. Well, the first is it shouldn't come with the digital health revolution. Taking patients' feelings, worries into account, basically empathy, should have been part of medicine for hundreds of years. But administration, many modern things that physicians have to do instead of focusing on patients took away that chance. But empathy should be part of that regardless of what technologies we use. And about the second one, we published quite an exciting video about that. I hope I can, yes, here it is. I'm sharing with you this video here, right in the chat. So, whew, it has been quite a ride with you. Thank you so much for being here, for asking these very thoughtful, very exciting and smart questions. I hope that we could go through the major things and I answered most of your questions. In the meantime, please check out our article on the future of hospitals on medicalfuturist.com. And even more importantly, please check out our newest ebook, The Guide to the Future of Medicine, or the Hospitals from the Future. I just shared the link to the Leanpub in the chat. We have a new season on our YouTube channel. Again, the new video comes out tomorrow, and then every week we will have new videos for you about many exciting topics. Plus, I will have more live Q&A streams. I will have guests, quite international experts in certain topics. So I hope that you will join us on those occasions too. In the meantime, please go to medicalfuturist.com, check out our free articles, analysis, our daily social media analysis on Facebook, LinkedIn, YouTube, Twitter, and Instagram. If you want to support what we do so we can keep on providing free content, please join us on our YouTube channel. There is a join button below and you can support us with that or through that. You can also support us on patreon.com/themedicalfuturist, where we provide exclusive content for those who are supporting us. And otherwise, just guys, be here with us. It's we are getting out of the pandemic. It has been quite the ride. There are many exciting things to come, many challenges to tackle. And myself and all the 15 people that work with me at the Medical Futurist and the Medical Futurist Institute, we will be here with you to analyze all that, to better understand where we are heading, to forecast what could come next, to essentially facilitate the paradigm shift that we call digital health, so all the patients in the world can become as empowered as possible. And when you take part in these live Q&As, you support us in doing that, by asking these great questions, by sharing the world with others. So thank you so much, guys. For those that I know that in the chat and who take part in almost all my live Q&As, for the new faces and new names, thank you for being here. I hope that you had a good time. Please check out the new video that comes out tomorrow morning on the Medical Futurist YouTube channel, and have an excellent morning, afternoon, depending on where you are in the world. See you next time. Bye.